morning and welcome to this webcast on assisting children following disasters and large-scale events. I'm Carla Vermeulen, the Deputy Director for the Institute for Disaster Mental Health at SUNY New Paltz. This is the 7th year that IDMH has collaborated with our partners at the New York State Office of Mental Health, which is the sponsor for this year's event, and the Office of Health Emergency Preparedness at the State Department of Health. Each year, we have all worked together to provide a web-based training on a different specific aspect of disaster mental health response. And the event continues to grow drastically every year. Today, we are going out to hundreds of participants who are tuning in at 14 OMH sites and 22 DOH sites across New York State. And we also have 9 additional sites within New York State and other state mental health agencies. As in past years, we'll be including some interactive exercises along with the main training content, which again will address the needs of children and families in times of disaster. And our presenter is also going to be focusing on providing you responders with the skills to maintain your own resilience when you're working with this most vulnerable population. Note that that is also going to be the topic of the 2019 Institute for Disaster Mental Health Conference, which will be held this year on June 7th. And at the end of this training, I'll give you some more information about how to find information about that event. So in the meantime, I am honored to introduce today's trainer, Dr. Robin Gurwitch. Dr. Gurwitch is a professor in psychiatry and behavioral sciences at the Duke University Department of Psychiatry, Child and Family Mental Health, and Developmental Neuroscience. I hope I got all that right. Really since the Oklahoma City bombing in 1995, Dr. Gurwitch has focused much of her clinical work, training, and research on improving outcomes and especially increasing resilience in children who have been through disasters and crisis events. She's a member of the American Psychological Association's Disaster Response Network and provides expertise on children and disasters and terrorism for SAMHSA, among many, many other connections and responsibilities. So she has really extensive experience as both a clinician and a trainer, and we are very fortunate to benefit from her expertise today. Please note that you can submit questions for Dr. Gurwitch at any point throughout the webcast by texting them to 518-407-5022 or emailing them to idmh@newpaltz.edu. So that's newpaltz.edu. And she will answer as many questions as we have time for at the very end of the training. So again, text them to 518-407-5022 or email idmh@newpaltz.edu. And if you are unable to submit questions yourself, please work with your site facilitator who should have a plan for assisting people who don't have the technology on hand to submit themselves. So I will now turn things over to our presenter, Dr. Robin Gurwitch.
Thank you. I appreciate it.
Thank you.
So I am very happy to be here with y'all today. So we have a lot to go through, and I think about it as sort of a big, broad brushstroke on this topic. And so there may be times that I talk a little bit faster because I know we have a lot to get through. Thank you in advance to facilitators at each of the sites that are going to be helping out with the exercises as we go along. So we'll just go ahead and jump right in and really thinking about how to help children in the face of these events. So this is a definition that SAMHSA put out on what is trauma, because I do want us to at least all be starting at the same place. Individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. When we think about disasters and large-scale events, certainly those can be events that do impact children's lives. So we take a look at that and we'll talk about ways to help support their resilience in the face of such events. In any type of trauma, what we know is unless we can be supportive and provide some ways to help children, any kind of trauma can really throw off their general trajectory of development. So we want to get it back on track as quickly as possible. When we think about the types of events, large-scale events that can affect children, there's several, and I looked through and I thought, wow, The state of New York has experienced many of these, unfortunately, and children were impacted along the way. When we think about disasters, we have to recognize that there are groups that are going to be more high risk. And if you look at this list, children are definitely on that list, but then again, children can fit into many of those categories. So children may be directly exposed to a disaster or other kind of mass casualty event. They may experience loss of a loved one. So although children weren't directly involved, for example, when the planes hit and the World Trade Centers in 9/11, many children lost family members. Women with young children seem to be a particularly high-risk group, and if you think about it, when you're talking about very young children, and this was really mothers, I'm sure if they did it again today, they may find fathers as well, but women really trying to figure out, how do children understand? How do I make sure that children can get their needs met? Because pre-verbal children may not be able to tell me, so they're dependent on me to interpret for physicians or nurses or others that are responding. And individuals with disabilities, individuals with previous history of trauma, and individuals with mental health issues, all are high risk. All those groups can include children, and we'll talk about those in a little bit. I want to give a little background. So I'm sure many of you out there, when I say back in 1980, are saying, oh, no, I wasn't around in 1980. Well, I was. I actually remember 1980. But up until 1980, there was this idea, if children experienced any kind of large-scale event like we're talking about today, or even trauma in general, we didn't need to worry, because they didn't have many reactions. Any reactions they had would be very minimal and go away pretty quickly, and so we didn't need to do any interventions. But something changed in 1980, very early 80s. So there was a shooting on a school playground in California. And Dr. Robert Pinus, who is like a pioneer in child disasters, child trauma, and is now a co-director of the National Child Traumatic Stress Network. Bob did something that no one had really done up until this time. Rather than asking the adults, how are children doing, he went straight to the children, and he began to ask them how they were coping with the shooting that had happened. And guess what? Children had reactions. They were not transient, and we really needed to do something. And that began to change, fortunately, the face of mental health as we understand childhood trauma. So now in 2019, we can't imagine an event occurring that we didn't talk to the children directly. So we've come a long way, and we're still making great gains. So the bottom line is, any time that there's been an event, we need to make sure we understand how children perceive it. What do they understand about it, so we know best how to help them? What are their concerns? When we think about the impact of trauma and disasters on children, they fall in, some of their reactions will fall into one of these four categories. So we think about academics, communication, the reactions that we will see, and any pre-existing challenges we know will become worse. So let's take these a little bit at a time. And think about academics. When we think about academics, when we look across the literature, what we find is that children who've experienced traumatic events, and I would put disasters or other mass casualty events in that, we see that it really can affect learning. So it can affect IQ, it can affect grade point averages, absenteeism. That should be a big red flag. Track kids in terms of days absent. If you have lots of absences, that may be a family that needs a reach out. decreased rates of graduation, higher expulsions and suspensions. So we need to take a look at what happens to children's learning and how can we help get them back into a learning environment as quickly as possible so that they can do better. We do know that oftentimes after an event, what we see is a minor decrease in school grades. If I don't know that as a caregiver and I see my child who used to be an A/B student now all of a sudden dropping to B's and C's, part of my worry may be, oh, my child's not studying hard enough, they're spending too much time on their electronics, they need to really buckle down and get back to school. If, on the other hand, we can make sure that both educators as well as caregivers understand that a small dip in grades is not uncommon, then maybe I can adjust my assignments, maybe I can help think through giving more support around homework than maybe I had to do before the event, so that they can come back up. And generally grades will start coming back up within about 4 to 6 weeks. So that would be something to look for too. When we think about communication, again, it would be great if kids could wear that on their jackets or sleeves or some way to say, hey, guess what? This is how I'm feeling and I'm really struggling. But they don't. And again, why don't we just check in with their parents or caregivers or teachers and say, hey, we need your help identifying those children and adolescents who may be struggling after an event. Well, the reason we don't just go there is because adults generally underestimate children's reactions. So knowing that, and we can ask, but that shouldn't be the only way we gather information. So why do adults tend to underestimate how kids are doing? Well, think about it. Any of you out there that are parents, grandparents, aunts, uncles, work with children, on your bookshelf, do you have your manual of everything you ever wanted to know about raising children and teens? They don't come with manuals. It would be wonderful if they did. So I can't turn to chapter 5 and read, wow, my child's just been through a horrific hurricane. This is what I can expect and this is what I need to do. We don't have that chapter. We don't have any of that. And it's an interesting thing, you know, I think about whether you buy Legos or washer and dryers or butterball turkeys, there's an 800 number that you can call for questions at any time around that product, or even to exchange and return any defective parts. There were many times I looked all over my daughter for that 800 number. It was not there. There were many times during teen years that I thought about needing to make a return. That wasn't possible either. We bear through it. We go through it, and things hopefully turn out for the best. But when we talk about disasters, what we understand is we don't have that 800 number. The good news is that the New York Department of Mental Health has wonderful resources, and there are resources available that we'll talk about at the end of this webcast, that if you need information to help support your work with children, that you can find maybe not the manual, but a lot of fact sheets and information that can be helpful. So why might adults underestimate? Again, not everybody gets the manuals, and so if you don't know what to look for, then you can't say, oh gosh, my child's struggling with these reactions because I don't even know what reactions I should be noticing. We as adults hope and pray that our children will be all right. And maybe if I hope and pray hard enough, everything will be okay, so sometimes I may discount what I see. It's not just children that are impacted. So adults are also impacted and distressed by an event. And adults' distress can sometimes make it difficult to notice signs in their children. Some reactions can't be seen. So if a child is feeling numb, how do you see numb? It's not out there. And so again, some reactions aren't seen, and sometimes children may do their very best to hide their reactions. So if I see my caregiver or my teacher extremely distraught, then maybe I need to tamp that down just a little bit because I don't want to make things worse. I don't want to upset them. So I may not express my reactions or let anybody know. Sometimes educators feel a lot of pressure, get back to routine, get back into school. And while that's important, so that return to routine is very necessary to help children's resilience after these events, it's not sufficient. So we have to think about other things as well. And again, communication may be very poor. So if there's been an event and for example, maybe there was a cousin or a grandparent or something that died as a result of that event, does the school get an information to know that, or even a parent? If their homes were damaged, does the school know? Because my guess is that in many instances, families don't call the school and say, hey, you need to be aware of this to make things easier. When we think about feelings and reactions that children may have, again, they come in many different areas. And we need to take a very developmental approach as we think about them. So children may have different fears and worries, behavior changes, physiological responses, how they focus, and then spiritual changes. When we think about worries and fears, for children, this really does take a big developmental approach, because children worry about their own safety and their own security. When you're talking about very young children, the world really does revolve around me, and me, and the people that are important to me. So I'm worried about my caregivers. I may worry about my siblings, depending on how I'm getting along with brother today. But my worry is pretty contained to the people I know and care about. As children get older, that sphere of worry, that sphere of concern actually grows. And so now I may worry about my classmates, the people at my school, the people in my neighborhood, people I don't even know, people that are removed from me that may be experiencing something that I went through. Or I begin to worry that could it come to me. I worry if it's going to happen again. I think about, for example, Joplin, Missouri, after the tornadoes destroyed much of Joplin and the schools rebuilt and children were going back. It was fantastic what they did in terms of getting back schools up and rebuilding and moving forward for the next school year. Anybody want to guess what weather was like in those first days of school when they returned? Yes, you guessed it. Massive storms, rain, thunder, lightning. So as children go back to school after the tornado and the weather is rain and storms, there probably wasn't anybody that wasn't thinking, could this happen again? And believe me, I'm sure teachers and school administrators and parents and caregivers that were sending their kids out were worried about that too. So did I really focus on geometry? I'm still trying to think about what geometry is playing a role in my life, but in any event, we have to recognize that there may be things that will trigger worries about reoccurrence or whether the situation is ongoing. Certainly if there's been any type of event that has many repercussions to it or ongoing problems, children may worry about how that's going to affect them. Children often experience guilt and shame, even if we recognize that that guilt and shame is unrealistic. Telling a child, just don't feel that way, is not going to cut it. But we have to recognize that children worry about the actions they took or maybe the actions they didn't take. They worry about anybody that was hurt or died and how did they feel about that person. Did I say, have a fight with my dad on right before he went out and he was killed in a car accident, and now I think it was all my fault. So again, it may not be realistic, but it doesn't change the guilt and shame that children may feel. For example, after Katrina, there were many young children that felt incredibly guilty because they didn't get all the necessary papers out of their house when they evacuated. Well, 6-year-olds really can't be responsible for getting all of those papers. That didn't change those feelings, and so children may have those worries. If we don't check in, we may not know. So if I think about these behaviors, if you read these behaviors, I don't need to read all of them, but think about a child that is inattentive, poor concentration, not getting their work done, disorganized, irritable, having problems with their friends, very hyperactive. You start seeing that, and we have been very, very well conditioned by the pharmaceutical industry. If your child has any of these symptoms, call your doctor for free samples of Strattera, Adderall, Concerta, fill in the blank. And if you can't afford this, don't worry, AstraZeneca is there to help. The problem is all of those same reactions for children that look like ADHD are also signs of children that are struggling after traumatic events, after disasters, after mass events. And so we have to think about, is it really ADHD? And then you have that overlap where you do see kids that have ADHD that also have trauma reactions or reactions to what has happened. But again, think about that, and all the medications are not going to solve this problem. And in fact, for children, medication should be really low on the priority list of where we're going, and for preschool children, it should be really off your list until a behavior treatment is tried. But again, those changes in behaviors, families need to know about it, teachers need to know about it, make sure places like school nurses are aware, make sure that your school resource officers may be aware that children's behaviors may look a little different in the hallways so that they can be mindful of what's going on. So you're probably looking at this slide saying, all right, how in the world is she going to talk about pandas in the face of disasters? So here's my pandas. So there was a horrific earthquake in 2008 in Western China. Tens of thousands of people were killed, many, many, many children. And the epicenter was very much around the panda preserve in Western China. And the pandas climbed up the trees. They were very distressed, very upset. They actually had to send people down to get the pandas out of the trees. They brought them down, they put them in cages, and they sent them all over China so they could rebuild the preserve. So they rebuilt the preserve, excuse me, and we were very fortunate that they allowed us to take a half a day and go and see the pandas. So we're going through the preserve and we see these 3 pandas, and they seem to be having a very nice time. And then we notice that the 2 larger pandas pushed the little one down a ravine. And we watched the pandas, and the little panda would keep trying to go up the ravine, and the 2 larger pandas would sneak around and they would talk to themselves or do whatever pandas do. And just as the little one was almost to the top of the ravine, the 2 pandas would run back and shove him back down again. When we think about that, when we think about what was happening, we were like, oh my gosh, this is bullying. This is bullying. Somebody go get somebody and make them stop picking on the little panda. But I say this to you to be mindful that after disasters, to be aware that bullying may increase. So children that were never bullied before may be targeted, and children that may not have been bullies may be bullying for the first time. So it's important to look at that. to recognize that behavior is really just at the top of the iceberg, and there's many, many other pieces that may go along with it. But behavior is certainly the biggest way that we may be able to identify children that may be having problems. Children also have physiological responses to traumatic events, including disasters, including large-scale events. And so they may have an increased sensitivity to sound. Their startle may be much faster. And honestly, when your startle changes, it doesn't necessarily reset. It may be triggered faster at any point. Children's bodies respond to trauma, and they may react with headaches and stomach aches and vague aches and pains. So again, look, if you're in pediatric primary care, are you seeing children coming in more frequently? Are they coming often? Are you getting calls to your office because Johnny is waking up again with a stomach ache? Check with your school nurses. Are you getting more kids reporting because they don't feel well? So think about what's happening. It's not that children are making it up, but there's not a medical reason. They can't find a virus or an infection or some other cause for it. That doesn't mean it's not real, but children are responding to the event that has happened, and their bodies are reacting in this way. So there's those physiological responses to a disaster that can happen. Oftentimes, too, children may have this because the worry about separation from their caregivers. And when I don't feel well and my caregiver stays with me, then I don't have to worry about that separation. And what if I'm not there and something happens?
Robin, sorry, I need to step up for one second.
Sure.
Hi. Hopefully I'm on. Yes. So sorry, we just want to explain to everyone we're having a little bit of an issue just with the slides being advanced behind the scenes. So we're trying to keep up with you behind the scenes.
Sorry.
But no, it's nothing on your end whatsoever. We will get it fixed. Just if anyone realizes that there's a little bit of a delay between what Robin is talking about and the slide actually showing up, we are working on that right now, and hopefully that will not be confusing, and hopefully people have the slide handouts as well, so they can basically follow along. So we will get that resolved. Sorry to interrupt. Thank you.
Thank you. And of course, while she came on, I took a sip of tea and spilled it all over myself, so there's my trauma. As we're getting back and talking about physiological responses, we also recognize that, sure.
Keep going.
Sure. You want to? I'm happy to let you take over. That would be awesome. We also think about children may focus a little bit more on the event. So with little kids, they may be much more likely to tell you the same story over and over and over again. That's what kids do. And if we don't know that, we may get really frustrated because, again, we may be distressed. And as that 4-year-old is repeating for the umpteenth time, I remember what happened when the storm came and X, Y, Z. And you say, yeah, you told me that. That doesn't change. They're needing some reassurance. They're needing some comfort from you and a recognition that, yes, you heard me and yes, you understand. As kids get older, sometimes it's harder and they may not be as likely to tell you everything that they're thinking, but it doesn't mean they're not focusing on it. And so sometimes, particularly with teens, we may ask the questions, what are your friends saying about fill in the blank? Because I am more likely to tell you what my friends are saying sometimes than what I'm thinking. But we have friends because we think the same thing. We have friends because we talk about the same things. So that may give adults a little bit of an insight into what's going on with our preteens and teenagers more than we may know. We'll talk about the impact of media in just a second, but also recognize that with any event, children are going to have trauma and loss reminders, and those are a little different. Trauma reminders are really going to be things that anybody that has gone through the same event probably will have. So it may be snow. It may be the sound of chainsaws. It may be sirens. It may be smells of burning wood. There are many, many things, and when you ask people that have gone through the same event, most of them will say some of these same kinds of reminders of that trauma. And when those reminders occur, sometimes we get a blip in our focus and concentration. Think about how that affects school. I really didn't hear the teacher say, get out your English book, because I heard a siren go by, and for a split second I was back to what was happening before. So we need to be mindful that processing may be a little bit disturbed. When we think about loss reminders for young children and adolescents, loss reminders are different. So if my grandmother made the pecan pie every holiday, and my grandmother died as a result of the event, and now somebody else is making the pecan pie, or maybe we don't even have pecan pie, that's a loss reminder for me, and somebody else may not have the same one. So again, loss reminders may be very different. Or I see somebody with a new bike, but I lost my bike in the storm. That bicycle is going to be a loss reminder for me, but it may not be for you. And then finally, we may see changes in spirituality. And those changes in spirituality seem to occur as kids get older, but it's no less important for them. So if they question, if they ask, again, we need to be open to listening. When we think about special considerations, think about children with special health care needs, whether it's physical needs, developmental needs, social, emotional, serious or persistent mental illness. All of those children need to be considered. So as you're planning, as you're thinking about preparedness and response, does your plan include these children specifically? For your children, for example, on the autism spectrum, do they understand what is happening in the same way? And if not, can there be ways that we let first responders know how to interact with children with ASD? For children that may have physical needs with wheelchairs or needing to have medication refrigerated, what's the plan if there's outages? So again, make sure that as you think about response, does it include children that may be outside of the normal developmental path? We certainly have to think about children that are undocumented. How do they handle things? And what we know after several events that have taken place are real worries. If I show up for help, if I tell somebody that I need something and I am, or someone in my family may not be here legally, what will happen to me? So that adds a whole nother layer of worry, and it may reduce serving children and adolescents and families that may need help because they're worried about if I ask, if I show up, if I request services, what may happen. I think anytime we have these events, and particularly in New York where you have many, many different ethnic, cultural, and religious communities that are beautifully interwoven into New York, actually all over this country, to think about, are we recognizing and are we addressing some of the issues and some of the concerns that may be affecting those communities a little differently? Think about death rituals. How are we handling that if there's been mass casualty? What does that, how do we involve our faith community in the recovery? And I know that oftentimes when we think about disasters, the big one that everybody thinks about is, oh my gosh, post-traumatic stress disorder, post-traumatic stress disorder. But all reactions and concerns are not just PTSD. So we know that bereavement is a big issue. Bereavement for loss and stress and other stressors that may happen. How does that impact recovery? We may have relocations that take place. And let me back up just a second. I'm a huge pet person. So I want to give a big shout out to families that have pets as part of their family. In a disaster, oftentimes there may be a loss of a pet or worries about my pet. That should not be discounted. It's not like, well, we can just go down and replace Fluffy. For children, oftentimes that pet represents a very close friend, a confidant, somebody that I turn to when I'm distressed, somebody that I share my happiness with, somebody that I enjoy being around. And so if there's a loss of a pet, please be mindful that that may be extremely significant to the child's recovery. If there are changes that take place because of the community's reaction or the damage, that may create some economic stressors. Maybe caregiver that was primary had to move for work, or maybe we had to relocate, or I had to go to a different school. All of those things can add extra stressors on children. So, I know it seems like, wow, that's a lot and poor kids. But the good news is that most children, in the face of even the most horrific events, will be resilient. However, that does not mean we don't do anything. Because when we can support children and teens, when we can help them and help caregivers, then we know that they will do better. And even if they were resilient before in a situation, doesn't necessarily mean that they're going to be resilient in this current one. So again, that support is important. When you have events and you say, gosh, we're going to have something for our community to say, hey, come and learn about how you can be resilient in the face of fill in the disaster or the terrorist event or whatever. You'll have very few people that will actually show up. However, if you say, come and we can help you help your children, your grandchildren, children important in your life, please come. We'll share ideas and information how you can support them. You will have many more people come. So we can reach adults in communities sometimes by helping give information about how to best support kids. We can also talk about what their reactions may be and how they can take care of themselves. You know, when we think about response to these events and how we assist, recognizing that disaster mental health is different than traditional mental health. And we were talking before the broadcast that sometimes that's hard when there's a massive disaster. Think Hurricane Sandy, where you really needed mental health people out there. That's great. But disaster mental health is truly different. And if we don't recognize that and respond accordingly, we're going to actually create more problems than we help. So when we think about disaster mental health or responding to a large-scale event, disasters not only affect individuals, but it affects the community as a whole. And so we have to take a community-wide look. There are many people that are affected directly, but there are many, many, many others that may be affected indirectly that may be struggling too. Disasters have different phases, so how I may respond in the first hours to days is going to be different than in the first month, 6 months, or a year. So being able to have services at different points along the way and plan for those services for children in the immediate but also in the long term becomes very useful. We often hear that expression, disaster stress reactions are normal responses to abnormal situations. And while that's true, because this is not something that I tend to, I don't expect to have a Hurricane Sandy every year. It's not my norm. But talking about normal responses, we need to be mindful that while we share, these are the kinds of reactions you may experience in the aftermath of the disaster, to help them recognize that things should start to get better within the next few weeks to 4 weeks is important, because otherwise, if I'm still struggling, I'm having intrusive thoughts, I'm still having behavior challenges, and now I'm 2, 3, 4 months, but I don't tell anybody. I don't tell my mom, my dad, my grandmother, no one knows, because somebody told me these are pretty common and normal, but they didn't tell me that if they don't go away, tell somebody. So we have to not only think about what are those common reactions so people don't think they're going crazy, but help them think about what are the next steps, how they should be getting better. Disaster mental health is really about practical assistance. This is not therapy. So I don't really care how you get along with your mom, dad, stepmother. That is not disaster mental health. I want to make sure that what I'm looking at is, how do I help you get from today to tomorrow? How do I help you get from 9 in the morning to 10 o'clock, to 11 o'clock, to 12? How do I offer that practical assistance? That's the difference. And sometimes in disaster mental health, we may interact with someone for one brief moment or a little bit of time initially, and we may not see them again. So it's not, well, I'm going to take however long you take to establish a therapeutic relationship. This is, what can I do for you now? And we need to think about that in many instances, communities have incredible services. We as mental health need to know about what are the services in my community, in the shelters. Anywhere there are services, we need to know about them in our faith community, because part of what we can offer is hooking people up with places that they are generally feel comforted by to get services that are available. Who are their support systems? Making sure we hook them up. I hope that I can be out of a job as a mental health person. I want to connect people with the support systems that they have. But I think it's also important, and we'll talk about this at the end, to recognize that there's an impact on those that respond, from first responders to mental health responders to educators, anybody that is responding to the needs of children, or for adults for that matter. We need to make sure that we recognize that they can be impacted as well. So why do we need trainings like this for mental health and healthcare providers after disasters? The bottom line is, oftentimes you're the first people that are going to be interacting with children or their caregivers. I think about, it was a while back, but the sarin gas attacks. Very few were directly impacted, but 5,000 people showed up to the healthcare system for screening. The best healthcare systems cannot handle an onslaught of 5,000 people in one fell swoop. So what we know is that the mental health concerns and worries are going to be the biggest ones after disaster. They're going to be the most long-lasting, and we need to take a long-term, not just what we're doing immediately, but over time. And how do we help reduce some of the anxiety and worry? How do we provide some information so as people are waiting for other services, even if there are medical triage needed, how do we make sure that we can reduce some of the anxiety and worry? So mental health may be called upon to help do some screening and assessment of physical and mental health needs. And for healthcare providers, you're often seen as a very trusted resource. So having information so that you know, here's what we know, here's what's going on, here's what we know is coming next, here are services, and here are things that may help you and your child in the days and weeks ahead. So that can be extremely important. And we think about emotional care as well. Again, recognizing that anybody that's been through the disaster is impacted by the disaster. When we think about how do we best support, Stephen Hopful and his colleagues think about empirically supported early intervention principles, and you can see these here. While we talk about safety and helping people remain calm and connected, I really want to point to hope, because oftentimes after disasters, children and adolescents may feel hopeless. And that's particularly important to recognize when you're working with adolescents, because if I see no hope, then adolescents who may be reacting with more impulsivity may engage in more high-risk behaviors, because what do I have to lose? So increased drug and alcohol use, increased promiscuity, increased risky behaviors, driving fast, putting themselves in dangerous situations, skipping school. You know, it's harder for a 7-year-old to engage in those kinds of behaviors than it is for a 17-year-old. So we need to be particularly mindful of our adolescents as a group to be particularly attentive to. And how do we make sure that we provide a sense of hope? I want to talk just a minute about psychological first aid, because that's something I truly believe that every single person should know, not just mental health. So everyone should know how to provide psychological first aid, just as everybody should know how to provide CPR. So the Red Cross has defined PFA as recognizing and responding to people who need help because they are feeling stress resulting from disaster situations in which they find themselves. So the day before, things were pretty good, and then all of a sudden this disaster occurred, and now I'm feeling extremely stressed. PFA is emotional support. Again, that practical assistance. This is information and education, helping people know what they can expect, making sure they have a plan for what are they going to do in the next hour, making sure they're connected, making sure that schools recognized here are some of the problems they may be having and how can we support them. There are different models of PFA. I am very active in the National Child Traumatic Stress Network, so I'll give a plug for the PFA from the network. It's actually free. You can take the course and download everything. But PFA, whether it's the NCTSN, the American Red Cross, any model of psychological first aid generally has these components. And the network has also developed a PFA for schools. And if you think about it, are there things that you can provide as students come back in the schools? Are they connected? Do they have family that they're with so they feel safe? Sometimes just teaching children and talking directly about the event is critical. So helping them know that, yes, this happened, but here's what our community is doing to help our recovery. Here's what our school is doing to help. So thinking through those events, sometimes for children, even little kids, all the way through adolescence, if I can find some way to help others, even if I've been impacting, and it may be as simple as helping clear debris, it may be something as simple as helping put a bulletin board back together at school. When I feel that I can help someone else, I actually do better, even if I'm impacted by it. Teaching children about common reactions so they don't feel as scared and they feel like this is somebody I can talk to. Also thinking through helping calming, teaching some basic relaxation skills. This helps not only after a disaster, but before I have to give a book report in front of the class or I'm up to bat in baseball, if I can do some basic relaxation. So maybe starting the school day with relaxation exercises, or after lunch with a relaxation exercise to help reduce some of the distress. As time passes, our need for what we do changes, and so thinking about for families and children that maybe are still struggling with some of their reactions, can we help? So again, here are a couple of useful resources that have been used. So things like, for example, from healing after trauma skills, we often have children create in schools a little treasure envelope that they decorate, and we talk about that. Sometimes after disasters we think about all the things that are gone, think about all the losses, but there are many treasures that we still have. We may have family, friends, our pets, we may still have our sense of humor, we still know how to ride a bike, we still can use a computer, all of those things, and we have them create little coins that they put in a treasure envelope so they can think about it, and at home as a family to think about what are treasures we still have. So again, thinking over time how things may change, thinking through how to help individuals think about in the months after, if they're still having reactions, what are some better ways to manage? How do we promote activities? Because oftentimes we may reduce our activities that we used to enjoy in the past. We need to get back to those as one way of helping. Schools are great places for providing support. Why? That's where kids are. That's where they spend almost all of their days. It's a familiar and comfortable setting for the majority of children. If there are screenings and assessments, you can do that rather than waiting for them to show up at the local mental health agency. You'll have a very different kids reporting to my office versus to school. And so there's decreased stigma, because sadly there's still stigma related to mental health. Sometimes you will see children that will present because I'm struggling with a disaster, but that just gets them the foot in the door. So disasters may be a time that we identify children that may need further mental health care. Parents are much more likely to be okay with services that are provided in the school because they trust schools as well. But there are children that may need mental health services, so here's a few things to keep your eye out for. Really sudden school failure that doesn't seem to be rebounding, any type of regression or delinquent behaviors, apathy, depression, any self-harming behaviors, withdrawal and isolation. Anytime you're worried about a child, ask for help, because services are out there and we don't have the manual. So being able to turn to somebody that not only understands disaster mental health but understands mental health issues as well, and good effective interventions can be extremely important. So anytime you're not sure, anytime a family is not sure, that should be a time to reach out and ask for help. Hopefully your disaster recovery plans are a little better than this. So with that in mind, I want to turn us to your first exercise. So you've got great facilitators that are going to provide you with a handout of an event and to think through some questions based on the information that you bring with you, as well as the information that I've covered thus far. To answer some of the questions, you'll take some notes and then report back and share with each other. So they're going to put up a wonderful clock to count down for 20 minutes, and I'll see you back in 20. Thank you so much. Well, welcome back. I hope that you had lively discussion around those issues and thought about some of the information that we talked about in the beginning, and were able to weave that into your discussion with that exercise. Again, there are wonderful resources available to you that can help continue that discussion as you're working in your communities and in your organizations. So as we move forward, you know, as much as we would like to wrap our arms around our children and keep bad things from happening to them, unfortunately, that doesn't always work. And what I recognize is that in a moment, in a heartbeat, everything can change. My change came in Oklahoma City on April 19th, 1995. So I was a very young psychologist at the time, doing work with young children with pretty significant behavior challenges, and I was working with the Oklahoma Department of Education and the Oklahoma Office of Child Care, and I joke half-heartedly that on April 19th, when there were so many children that were killed in that terrorist attack, that they looked in their Rolodex. I know some of you were saying, what's a Rolodex? But, and my name was one of the names they had with somebody that knows something about children, but I felt something like out of Gone with the Wind. I don't know nothing about trauma and disasters, Miss Scarlett. I was very fortunate. Like I said, I remember calling Dr. Bob Pinus and saying, you don't know me, but, and his first response was, what can I do to help? And so I think since '95, I was just back in Oklahoma City recently at the memorial talking about the 25th anniversary coming up, which is hard for me to imagine, but how much our field has changed and grown. I give great credit to the work that's being done here in New York by your Department of Health and your Department of Mental Health and your school systems. It's just been incredible. To the National Child Traumatic Stress Network has been amazing across the country. Many, many, many advances since Oklahoma City as we've learned and moved forward in terms of how do children understand and how do communities recover after these kinds of events. So that's the good news, is that we continue to learn more and continue to have discussions and continue to think about where things are going. I think when we talk about any type of terrorist event or any type of man-made event, Sun Tzu really said it best, kill one and terrify 1,000. To think about what that's been like in this country over the last few decades. When we think about other issues that are hitting our monitors, to think about invisible agents and recognize again that the mental health concern, the worry, the anxiety, the distress is going to be probably much greater and more long-lasting than the physical impact of these events. And when we think about children, we're just beginning to recognize about medical countermeasures. What do we know about treating children that may be exposed to different agents? Where does the stockpile stand in terms of children? But the biggest contagion when we think about these events is the emotional and mental health contagion, the worry and distress that will pass across very quickly and quickly outstrip our resources. So again, I think having everybody from school personnel to anybody in a healthcare setting, to definitely our mental health care settings, to be prepared to address from a disaster mental health standpoint, what can we do, how can we triage mental health concerns as well. I want to shift us just a little bit and talk about something that sadly has become part of our daily discussions these days, and to talk about school shootings and what that's like for communities. Because as that comes, definitely what we know is that children are front and center with these events. But what we know about school shootings or any type of disaster situation, whether they be man-made, whether they be shootings or natural disasters, there are factors that can make a difference and make things better or worse. So when we think about those, we know that one of the biggest risk factors for risk for mental health problems is just how exposed a child was. Adults too. But the closer you were, the more directly involved you were, the higher the risk. Certainly if you were injured or if a child suffered a loss, that puts it up. We're going to talk about media in just a second, so bear with me. One of the biggest things to consider is how quickly families can be reunited. The longer it takes to reunify parents with their children, the more at-risk children are. And I will tell you, sometimes I talk to schools and they say, gosh, we're not going to tell our parents where they need to go to reunify with their kids. And if they can't come in because we have to shelter in place, we'll just put police tape around the perimeter of the school and nobody will cross it. And I'm thinking, oh my gosh, have you met a mother of a first grader? There's no way a piece of little yellow tape is going to keep me from getting to my 6-year-old. So we really have to think about and make sure that part of those messages include how do we get information about how to reunite with your child. Where do you go? What do you do? How children understand it. It is a different age now. We know, and so sometimes when there's an event that occurs in community A, the question is, well, do we really need to worry about community B, C, and D that are far removed? The answer is yes, because those children hear about it, they see it, they hear adult conversations, and the worry goes up, and the question is, can it happen in here? And as Oklahoma City certainly taught me, it can happen anywhere. So there's really not a it can't happen here answer, but here's what we're doing. One of the biggest ways we can think about how well kids will do is how well their parents are doing. So while we need to reach out and make sure we support children, giving parents information of how they can support their own children, but how they can take care of themselves becomes extremely important in terms of looking at resilience in the community. There are wonderful protective factors, good relationships in schools, good relationships with teachers, with peers. Children that are involved in other activities, in extracurricular activities at school, in clubs, in sports, or outside in their cultural, religious, or ethnic communities. Children that are involved in other activities seem to do better than those that are more isolated. And a willingness to ask for help. We need to make it okay to say, you can talk to me about anything, about the hard stuff. And oftentimes that's a question that comes up. You know, I don't think my child knows about the shooting that happened in Texas, so I don't want to make them worried. Or I don't want to tell my child about what happened at Tree of Life Synagogue. I don't want to make them worried. To think that they don't know, my goodness, we're burying our head in the sand, because they will hear about it from older children if they're young. They'll hear about it from adult conversations that you didn't think they were listening to. They'll walk into a grocery store and they'll see pictures of it on the newspapers that are right next to the checkout. So we have to talk to children about difficult topics, and sometimes starting that conversation can be challenging, but it's absolutely necessary. And starting out with, there was a horrible thing that happened, tell me what you've heard. And if they've heard about it, you'll find out where they are. If they haven't heard about it, you can say, this happened far, far away. Here's what's happening. Here's what they're doing to help people. And here's what we know in our community that we do to help all the time. Media. So we have entered a whole new world. We see events unfold on the spot as events happen. So children see it. We interrupt this special with a special report on TV. It interrupts on radio. It interrupts and inundates social media. So we need to be prepared to understand and help children with images that they may see, with stories they may have. There is an off button for a reason. If you are working with families that have very young children, they should not be watching this coverage at all. They don't understand it. 9/11, there would not be a single building standing because preschool children do not understand instant replay. So how many times were those buildings collapsing, replaying over and over and over again? So we need to make sure that with very young children, we really do turn it off. Have them watch something else or do something else. As children get older, they, particularly middle and high school, excuse me, These may be events that become part of discussion in civics classes, in government classes. It's definitely going to be something that they talk about. And so if you're at home with them, you may watch it for a little bit and then turn it off. After Boston Marathon, wonderful colleagues, John Comer and his colleagues, looked at families that tried to shield their children from any information around it, or families that directly addressed it. And what they found is that families that actually talked about it rather than trying to protect their children, those children did better because people talked about it. So having the hard discussions can be really important. And sorry about this. We're in a new age too. Social media is all over the place. There's blogs, there's tweets, there's all kinds, there's Instagram, there's so many things. So we need to make sure that we ask and monitor and look at what's happening across social media so we can address any misperceptions, any misinformation, and we can correct that for our children. When we think about delivering services, we need to think about things before we just jump in. I will tell you, I will never forget after a horrific event that the schools were really good at monitoring who came in, and yet a group thought they were very proud. They got around all of that and they went into an alternative school to provide hugs. Needless to say, at an alternative high school, strangers coming in and just wanting to hug them was not going over well. They went around, they didn't check in, and it created so many more problems. So as you're thinking about and setting things up, and I'll finish that story, they were telling what they had done and they were so proud of it, and they asked an expert, they said, don't you think that that was a great thing? And he said, you've already done it. So whether or not it was good or bad, you can't change it because you've already done it. So now if it wasn't good, which of course it wasn't, other people have to go in behind you. So think about all of the things that go into any of these types of events. What's happened? What do they know? What are the resources around? Thinking about at-risk populations, who they are, who may need that extra reach out, and being very sensitive to any cultural or faith or ethnic or racial issues that may be involved in these events, and the recovery, and how do we do this with sensitivity. Who are your partners for these events? Calling up somebody afterwards and say, hey, do you think we may be able to work together on this, is not the time. Identify your partners early, so God forbid there is an event, you already have somebody's name in your contact list that you can reach out. It's not a stranger, and you can immediately begin to work together rather than thinking about, okay, do I know where my resources are for mental health, for health care, for even in the business community, if I need refrigeration, who do I go to? Find partners ahead of time. I think it's also really important when you're talking about mass violence, how are community and school interventions, what kind of special issues do we need to think about as we address them? Because when it affects, when there's a mass violent event, it affects the entire community. But for families where there have been deaths, we have to recognize that their loss is very public now. It's on the news, it's out there, it's on display. So how do we help them grieve privately when they're being shown this over and over again? How do we support families from being allowed to have that private moment? And all bereaved families are not exactly the same, so how they grieve may be different, how they react may be different. And giving space, I think it's so important to make sure families know, no, there is not a rule that says because this happened to you, you now have to talk to any media person that asks you. It is okay to say no, it is okay to filter it, because oftentimes individuals that were exposed to these events are out in front, and what we hear very often is, I wish I hadn't said X or Y. I wish I had done this differently. So being mindful, working as a partner with your media. They are great for getting messages out, public health messages, information about resources, and information about what your community is doing. So when you think about partnering, think about your media outlets, all types, radio, print, social media, and TV. How do you work together to get out the important messages? Thinking about how to protect, because believe it or not, you will also have, after every one of these events, individuals that will stand up and make it worse. For example, after Sandy Hook, you had many people that came out and said Sandy Hook didn't happen, it's all a big hoax. Well, for that community and for grieving families to be inundated with that kind of media can be so much more harmful. So being mindful and monitoring and making sure that there are resources to support your community when that kind of activity occurs. We also have to think about complicated mourning, and by complicated mourning, thinking about the combination and the intersection between bereavement and the traumatic event. And what happens with complicated mourning is that sometimes it's hard to get to the grief because I can't get past how it happened. I can't get through the trauma. So it may be harder for individuals to actually be able to move forward. It may be harder to reestablish social connections, particularly if it's in the public eye. And oftentimes being able to stop thinking about the horrible way that my loved one died, again, makes it very, very hard. So thinking about those individuals as a special risk group. When we think about, too, who is more likely to have, when is complicated mourning more likely? If there's a traumatic circumstance, so a school shooting or a terrorist activity, or something like happened with Nevada, with the shooting there, that creates many, many, many more layers, and the circumstances of the deaths become even more traumatic if it's associated with criminal activity, because that adds a whole new layer of support, but also investigation and what can happen and how things are managed. So thinking through that. I know it's sometimes hard to think about, but sometimes when you have deaths that are in the public eye, or even deaths that are not socially sanctioned, so suicides is one that becomes very hard for people to talk about, and I think we need to, but that's not the purpose of this lecture, so I'm just going to put it out there and then we'll move on. But to think about, too, the perpetrator, because that perpetrator had friends, had family, had other people, and so who supports them? What is that like? And then to consider those involved in handling any kind of crime. So if it is mass violence, like school shootings, like terrorist events or other types of mass casualty shooting, yes, we think about first responders, police, other law enforcement, paramedic, fire, but even the dispatch that's sending responders out, that they need to be considered as a special population that may need our support. Not may, that definitely need our support. Think about school administrators, not just the teachers, but also the administrators, the SROs in the schools, the janitorial staff, the lunch ladies. How do we support them as children are coming back after a horrific incident? What is that like for them? When there's a crime, you have individuals from the state's attorney's office, from the coroner's office, that are managing evidence. They need support, particularly if children's deaths are involved. There is something about death of children that make things so much more difficult for all of those that respond on a daily basis. But then if there's mass casualty, think about funeral home directors that sometimes are brought in for services and activities that's not on their daily plate, but that they're being asked to do more. Journalists that cover these events, I'll give a big shout out to the DART Center that is phenomenal to supporting journalists that cover traumatic events, disasters, mass casualty events, or other types of trauma. The DART Center really does support journalists, no matter what kind of journalists they are. So when you work with that partner, I would hook them up with the DART Center, which is based out in New York, which is awesome. Human resource officers, offices, are really important too, because as EAPs and other places, people may come in and say, I need help with my children, I need help for myself. They're hearing these stories as well. And then in communities, special health care needs are often groups that we don't consider. I talked about non-documented, undocumented, but persistent mental illness also. Individuals that are already in therapy, we need to make sure are in residential treatment or other inpatient settings, or just therapy in general. We need to make sure that when mass casualty events occur, that we take special consideration because they are at higher risk. When we think about factors to consider with children that are grieving, how do they understand death? What's their developmental age? Personality characteristics. Children that are more shy and reserved actually have a harder time than children that are more outgoing, because I'm more likely to ask for help if I'm outgoing than if I'm shy and reserved. How do they cope with other difficult circumstances? May give you a window of how they may do now, and any past experiences they've had around death, rituals around death. Again, different cultures, different ethnicities, different religions handle death differently. We need to be mindful that not everybody does it the same way I do. So how do we do that? And when we think about schools, we have to think about students who may need extra care. This is a long list, and you're like, who's left? The answer is nobody's left. Every student, for different reasons, may need special attention. So if we think about what's happened, sometimes we don't always consider all of these variables. What happened if the shooter in a high school has a sibling in the middle or elementary school? Do we make sure that there's services for those schools as well, particularly in smaller communities? When we think through if this was a child that was bullied, what about the kids that picked on him? Or if he was a bully, what about the children that get picked on? How do they react? So there are many, many students we have to think about, and then other things to consider. Do we go back? What do the lunch tables look like if it took place in the lunchroom? What does the classroom setting look like when they go back into a classroom? So all of those things need to be considered, as well as considerations about who was friends with the person that did this. What is that like for them? Siblings, teachers, what was that like for them? And then thinking through grief. That grief is very different, and you unfortunately probably know that if you've been fortunate enough to have lived this long without losing a close friend or family member. Count your blessings. But many times we know that children will experience the death of a close friend or relative before they graduate from high school. That's more likely than unlikely. And everybody handles grief differently. So how do we make sure, when we're talking mass casualty, there are going to be so many rumors that we need to be on top of. There needs to be information that's given in a pretty regular basis. And sometimes the best we can do is say, this is what I know now, and this is what, as new information comes up, I'll share that with you. One of the things that's also important for schools is to work with them to think about messaging. And different schools will do it differently. If something happens in a community or nationally that really is going to affect all of us, how do we let students know? Because again, there's texting that happens. But in some schools you may say, gosh, if I'm working in an elementary school, this happened in a high school somewhere else, I'm not going to disrupt my day. If something happens in a high school, I may take a different tact. But everybody in the school needs to be on the same page about how we handle it. And there are triggers in school settings that we need to consider. So if there's been a death due to, I'll take something other than a school shooting. Let's say there was a horrific car accident and popular athletes were killed in the car accident in the school, and so the school's in mourning. And you're reading something in English class, and in the book that you're reading, there's a car accident and students are killed. That's going to be a major trigger. It is important to think about. I remember, A Star is Born just came out. Wonderful movie. It's terrific. If you don't know that there's a suicide in it, and if it's a spoiler alert, I'm sorry, but I'm really not. If your family has been impacted by suicide, and you don't know, and you go to that movie without knowing, bam, in your face, and now I am experiencing all kinds of reactions because I was not prepared. So we need to make sure that as we work with children after mass violence, to think about other triggers that they may have that may make it harder for recovery and healing. And thinking about special occasions, birthdays and holidays, or rites of passage, recitals, sporting events, proms, bar mitzvahs. What is that like? One of the things, and I'll give you my 2 cents, I absolutely detest donuts with dude day. Donuts with dad day, because there are many, many reasons that dad may not be there. Maybe dad died in a mass violence occurrence. Maybe dad is deployed, so he's not there. Maybe dad is in prison. Maybe dad never was in the picture. Maybe dad is divorced and lives far away. There are many reasons there that donuts with dad day, if a child thinks that's important. I remember my friend's son, I was asking him who he was taking with for donuts with dad, because his dad travels a lot and wasn't going to be there. I asked him, was he going to take his much older brother or an uncle with him to Donuts for Dad Day? And he looked at me he was in 2nd grade, and he said, "Robin, it's donuts with dad. I can't go because my dad won't be here." So think about changing it to donuts with dude, or rather than muffins with mom, talk about what is a mom, and then ask them to bring the person that embodies those characteristics. So think about when you have these special events, what that's like for children. While it sounds really nice on the surface to bolster connections in school settings, what that may be like for students that may have had problems because of an event. Candlelight vigils, spontaneous memorials, anniversaries, those all need to be thought about with care in advance. What is that going to be like? So, for example, a school in a very violent area in one of our cities in the United States started planting trees each time a student was killed. Well, because of the amount of violence in that area, there were lots of trees. So imagine going to school and you're walking through basically an arboretum of death. What that's like, thinking about safety. So we really have to think about what happens with all of the spontaneous memorials, what happens with all of the materials that are left, the cards and letters that pour in. So thinking through, how do we consider and plan for memorials so that we can be respectful, that students can be involved at a level that they should have a voice, whether it's really young children or older children. Adults saying, here's what we're going to do, takes their voice away, and their voices are so important when we're talking about events like school shootings or other mass violence that impacts kids. So with this information, I want you to take what you saw in the first part, and then what we've talked about in the last about 35-40 minutes, and I'm going to have you switch gears and think about, for exercise 2 involves a school shooting. So thinking about some of the ideas that you took away from the first part, adding it with some of the information that we have presented here, and with your facilitators' help, thank you facilitators, get into groups and again solve the problems of this so that your community can be better prepared. So I'll give you 20 minutes. We'll start the clock and I'll see you back in 20. Thanks. Welcome back. I'm sure that the 20 minutes probably flew by because those were pretty rough discussion points to try to put together in your thoughts in just a little bit of time, but hopefully you had some lively and rich discussions, and thanks again for the facilitators. A lot of what we're talking about are topics that we could take days to spend on these, but we have just a little bit of time. So again, big brush strokes that hopefully will lead you to think, okay, here's what I know. It reinforced things I already know. It added a little bit of new things, and it made me hungry to learn more. So I'm sure there will be many more programs offered here by Department of Health and the Department of Mental Health around these issues. I would be remiss as a Red Cross volunteer if I didn't encourage anyone that's not a Red Cross volunteer to think about connecting with Red Cross in your communities. There's always need for anyone, mental health, nurses, physicians, just anybody, that there's so many jobs and opportunities that are available, and when disaster strikes, as Red Cross says, all disasters are local first. So a plug there. I also want to help you think about, as you consider planning in your communities, to think about, for example, many groups that respond, that's not their daily job. So we have volunteer firefighters, for example, that may go out because they have that commitment in their community, often rural, that are involved in responses to situations that they never expected, may not have the intense training that firefighters in big cities get in terms of managing some of these challenging situations. And then they go back and they have to just resume life as opposed to going back to the firehouse and working to get together for meals or whatever with their buddies to talk about what happened. So think about that. I think about in schools, oftentimes what we know is that event like in Exercise 2 happens, and schools all over say counselors will be available, which is fantastic. Making sure that, again, that you partner with your mental health community, with people that have been trained to respond to these types of situations. And if you don't have enough, then offer training for them to provide that support in mass casualty situations so you can have that group. But to recognize, too, that counselors in a school where mass violence has happened are also impacted by that event. So that school counselor providing the counseling services when he or she is intimately involved may not be the best. It's not that he or she can't be supportive and a part of the discussion, but making sure that you have expanded your circle of who is help supporting and who is supporting the counselors is also important, particularly when children are involved, because you hear all of those stories. There are many sources of funding that come up after mass violence, and there's some ideas. But as you plan, what we hear over and over from communities that have experienced, sadly, these events is the donations come in and we're not as prepared as we thought we were to figure out distribution to cover not only the immediate but the short-term and long-term needs of a community, to figure out who gets what, when, where, and how. So thinking through those. I also want to make sure that I provide you with some information. One of the things, that first one is a free app that people can download if you just go to Help Kids Cope, and it gives information on some ways to support children after different types of natural disasters. So it's a great app for families to have, or professionals that need to look as they're working, but there's several different ideas. And then the good news is, you know, that we have come such a long way in our understanding of the impact of disasters and mass casualty events on children and what we can do to help, on our understanding of trauma and what we can do to help. And we've just, the field has exploded, the field has really grown and changed, and the science is a huge foundation. So these are evidence-based and evidence-informed treatments for children that have experienced traumatic events, so I leave those to you too. I want to close our time together talking about taking care of yourself. And yes, I know, you're like, oh yeah, we get this all the time. But it's serious. If you are not taking care of yourself, and it's trite, but it's true, you cannot provide the best care to those that you set out to help. And so I really do want to take our remaining time to talk about what kinds of considerations we need to think about and how do we do this. So I want to give everybody out there a quick psychology screener for deciding whether or not you may be more stressed than you know. So this is a picture. You should see two dolphins jumping the waves. If you see something other than two dolphins, that's an indication that you may be carrying around a little bit more stress, and so this is something to pay attention to for the next time that we have together. If you see two cows, please go to your nearest mental health professional and let them know that you are really, truly overly stressed. If we think about what does compassion fatigue mean, or secondary traumatic stress, STS, it's been defined as the experience of short-term exhaustion and traumatic stress reactions associated with exposure to the suffering of one's clients. Basically, you care too much, and you're taking in their stories, and they are becoming part of who you are. There's a big difference. I know we hear all the time, oh, burnout or compassion fatigue or STS, and they really are two different things. When we think about compassion fatigue, for example, with schools, it's the teacher's relationship with the student who's experienced trauma. When we think about compassion fatigue, the symptoms are very similar to PTSD. When we think about burnout, I'll use the school example again. It's the teacher's relationship with the school system, and my feeling that no matter what I do, I can't get my needs met for my students. There's all these new rules and regulations and metrics that are used, and so it's the relationship with the institution, not with hearing from those that may need help. So I think it's important to understand those differences and to recognize that stress does impact all of us. So I want to give credit for the next slides that I'm going to present. The Department of Education back in 2012 said, hey, you know what? We recognize that teachers really are listening to children's stories quite a bit, and it is impacting their ability to be the best teachers and school staff and personnel that they can be. So they brought in a bunch of us and said, can you create something for educators around compassion fatigue and STS? And so this is pulled from some of the work we did, but I think it has legs to apply to everyone. When we think about the personal impact of compassion fatigue, it affects us on all of these levels. From a physical end, as you look at this, to think about just feeling overwhelmed. If you're finding yourself, gosh, I never get sick, and now I'm sick all the time, I'm not feeling good, my immune system seems to be compromised, it must be this weather. Think, what impact is your stress having on keeping your immune system strong and healthy? And so it does, to recognize that stress does take its toll on our bodies, and we may start seeing difficulties. One of the biggest difficulties and areas that happen when we're stressed is sleep. We know that sleep, it really takes a hit. I will share with you, when we were in China, like I told you, after the earthquake there, we were asking volunteer teachers who were coming back, tell us about your sleep. And they said, oh, we don't have sleep problems. And we thought, wow, is this a cultural thing in Japan? Sleep, it really isn't an issue with increased stress or exposure to disaster kind of settings. And we talked more and more with them, and what we found out is they didn't have any problem, because what they said is at the end of the day, they got together and drank till they passed out. So sleep wasn't an issue. So please, that should not be your thought of effective coping. So it should be a big red flag that says if you're finding yourself involved in those activities, that may be a sign that you're having too much stress. But to recognize that it does take an impact physically. Compassion fatigue, secondary traumatic stress also affects us emotionally. So we may begin to feel, because we keep hearing stories over and over again from the children, from the students in school systems, from our work as first responders or crisis counselors or doing disaster mental health, and we start feeling sad and hopeless. We may become numb to it because I can't take on anymore. So I step back. But the other thing that starts happening is we become a little bit more irritable in our relationships with others. Our emotions are on a roller coaster, so that can be a problem. And then we also, when we're dealing with compassion fatigue and STS, we may also have behavioral impacts for ourselves. And so we may see changes in our eating and our sleeping, and we may withdraw. We may become much more impatient, and you look in the mirror and you say, that is not who I am. Who is this person looking back at me? I'm usually much more patient and empathetic, and now I'm snapping much faster at others. Be mindful that we're not immune to drinking a little too much, engaging in other kinds of high-risk behaviors. If you're seeing that, it's a problem. But other kinds of behavioral impacts that we sometimes will just put aside, absent-mindedness, more accident-prone. So I'm not seeing things as well as before. And then compassion fatigue and STS can impact our ability to think, our cognitive processing. So our concentration is lower, and we have difficulty making decisions, whereas before we could make decisions pretty much with ease. And we become more rigid, and it has to be done this way. And if we don't do it this way, then that's not correct. And we have problems, or we may have self-doubt. But the other thing that may happen is we hear the stories from the children that we're working with, that we're involved with, and those become part of us. And now, not only am I having a hard time getting rid of images that I may have experienced, but I'm also adding all the images of the children and the teens that they're sharing with me, and those are becoming part of my intrusive thoughts. So it becomes a problem. When we think about the impact on us interpersonally, we may find that we are having a harder time connecting with our partners, with our children, with our coworkers, because of that interpersonal impact. And it can affect our parenting abilities, our caregiving abilities, that I am not as available, and so I'm not as involved. We may see our anger getting higher, and so the risk of taking our anger out on our children can go up. I may become more isolated. I may become more impatient and intolerant of others and unavailable. And what can really start happening is that we may, from an interpersonal and that professional level is that I start looking and I think, okay, you know what? I am really good at what I do, and I'm going to work extra. I'm going to see more, because if they don't see me, then they have to go see Steve. And Steve may be good, but you know what? Honestly, he's not as good as me. And if he's not as good as me and they have to see him, then maybe they're not going to be as resilient and they're not going to recover as quickly. And so, gosh, they really need to see me. So I work extra hours and I spend extra time and I hear more stories, because if they don't get me, they get Steve. Or the flip side, I can't even walk in Steve's shadow. He is so good, and I begin to doubt my abilities, and so I work harder and longer and try to do more, just so that when somebody sees Steve, they don't say, well, you know, Robin's okay, but at least she's trying hard. But either way, if you start sort of becoming grandiose or start doubting your abilities, either side of that can be an indication that you may be experiencing some STS or compassion fatigue, and maybe need to think about taking that step back to do some self-care. We know that STS and compassion fatigue can impact us spiritually, and so it can affect our understanding and our relationship with a higher power, with God, and we may begin to question our religious and spiritual beliefs. And if that was something that grounded you before, it can become extremely problematic if it's upsetting you now. And then all of this has a professional impact. Our abilities to perform our jobs, our morale, our interpersonal relationships can all take a hit. So we have to be mindful and be recognizing that it can have an impact on us professionally. You know, one of the things, and I can't remember, it may be there, so I'll repeat myself if it comes up, is that one of the biggest risk factors for having compassion fatigue is being empathetic. So if you are in mental health or healthcare or education and you are not empathetic, please go find another job, because we need empathy in the work that we do to be effective. But with empathy, there's a risk. With empathy comes caring. I used to think about, way back when, I'll digress for a second because I think I have a minute or two. So I used to watch Star Trek, the original one, with my daddy. And when we would watch it, I remember this episode called The Empath. And what she could do was feel the pain of someone else, and she could put her hand on them, and all their pain would come into her, and then she could release it. The problem is we don't have that special skill. So unlike the empath from Star Trek, when we hear those stories, when we see and we share those experiences, that comes into us, but we've got to figure out how to let it go, or it just keeps building and building, and before we know it, we have developed STS or compassion fatigue. So how do we prevent STS? The first thing we have to do is make sure that we are aware that it even exists. If we pretend that it's not there, I'm immune, you know, I'm a mental health professional, I can do anything, then we really are setting ourselves up to actually be one of its victims. So how do we address it? One, we need awareness. We need to make sure that our agencies and the systems we work with all recognize that anyone that works within the healthcare system, within the mental health system, within the responder system, within the school system, anywhere where you're going to interact with people that have been touched by violent events or disasters or any kind of trauma, need to be aware that this is there. It can be introduced yearly with new hires as part of orientation. It should be introduced with new hires that come off time. And I think about with schools, it may be part of a school system that we talk about compassion fatigue, but what about the substitutes? Do they get that too? So just to think about. And think about self-care, which we'll get to, self-care plans. There needs to be a balance. Balance is oftentimes hard to do, but how do you balance work and fun and family and humor. How do you maintain that so that it is part of everything? And to consider, how do you balance your work-life demands? And then finally, we need to think about connections. How do we make sure that we connect with people that we work with in ways outside of just our daily jobs? And so what do we do to connect with others? How do we handle if there has been a tragedy, if there has been a disaster? How do we reconnect with the people we work with to keep lines of communication open? And how do we make sure that individuals have a safe space that they can talk to and ask for support without feeling like it can be used against them as saying that they're not fit for duty? Because if we don't set things up so that we keep lines of communication open, if we don't have that awareness, balance, and connection, then the system itself is set up for anybody that works in that system to develop compassion fatigue, and then you lose really great workers that can respond. When we think about mindfulness, mindfulness means paying attention on purpose. It's not just sort of zoning out, but what we know about mindfulness is the research on mindfulness says it's good for us. It helps prevent all of these things. People that practice, look at the benefits of mindfulness. And mindfulness is not easy. It takes practice because intrusive thoughts come in. So being mindful can have these wonderful effects. I don't need to read them to you. But there are also challenges when we think about self-care. One, believing that it can happen to you, or not believing is important. If you look around and you say, everybody else seems to be doing great, so what's wrong with me? You may not know what they're experiencing, so don't just assume that. You may feel guilty and shame because I'm taking some time for myself, but there's a reason for that. As a Red Cross volunteer, you can't just work indefinitely. You have to take breaks. That's important. I think it's also important that it starts from the top. If your administration, if your boss, if your leaders are not taking time off to take care of themselves, then the people working underneath feel like, oh, I can't take time off either because they're not, so I need to show that I'm a really tough, high worker. And pretty soon the system becomes afflicted with compassion fatigue and STS. So I want to take just a little bit of time and talk about an idea of how we can create your own self-care plan. How do you think about that? I would encourage you to think about from an agency perspective. What do? How does your agency work? For example, when we were doing an STS training for an agency, we had them think about, all the agencies think about, what do we do to take care of ourselves each time? And somebody said, well, and when you think about a plan, you need to think about not only a plan, but how do you know if it's actually working? So what they did, they said, once a month we're going to have sort of an agency lunch. But here's the key. When you come to this monthly lunch, it's potluck, everybody brings something, but you can't talk about work. Any work talk, and you have to put money in a jar. And they said when they first started, there was enough money in the jar that they could pay for lunch for the next month. But over time, as people realized that this was serious, we're going to really think about how do we connect outside of work and leave work behind just for an hour. The money started going down, and they realized more people were coming to the lunch and there was less money in the kitty. So when you think about what do you do, think about how would that work? How will you know if it's working for your agency? If you say, oh, we're going to do a walking thing, although I did learn today in Albany there's great underground tunnels, but if your idea is we're going to take an outside walk, I'm sorry, in New York, y'all are freezing cold. So going out to take a walk when it's sub-zero temperatures is probably not going to happen. So what are other ways you're going to take care of yourself as an agency? But I want to talk about what we say is the basic pH. And this was developed by a psychologist in Israel, Muli Lahad, who gave me permission to sort of adapt it like I wanted to do here. So the basic pH says that everybody has their own way of coping, and what works for me may not necessarily work for you. So we need a menu of possibilities. We need to develop a menu of options so that at any given time I can choose from my menu to be able to reduce some stress. So I want to go through what these look like and think about. And since y'all are way out there, I can't ask for you to raise your hand and give me ideas, so I'll share with you ideas that others have shared, and as you talk about in your next exercise, you'll think about your own. But if we think about it, when we think about the B stands for beliefs and values. These are things that we tell ourselves in times of stress. So if you've ever worked with children or have had children, then you know Bob the Builder. And can we do it? Yes, we can, would be Bob the Builder's mantra. That when things get tough, I know I can do it. Or the little engine that could, I think I can, I think I can, I think I can. So these are statements that we make to ourselves. Don't sweat the small stuff and everything is small. This may be our values. I believe that the world is basically good and this is just a blip. So what are those belief statements? If your faith is important, it may be, through Christ all things are possible. I'm Jewish. I probably am not going to have that on my list under B, but I may have something from the Jewish faith that is a belief or a value that I think about, and that would be something that I remind myself in times of stress. So all of us have different things that we may say. It's always darkest before the dawn. What are those things that we say under beliefs? When we think about affect, what we're talking about are these are things that we do to just truly express feelings, getting feelings out. I hate cleaning my house. I despise it. But I know that when I clean my house, I turn up my music full blast, blues, because nobody understands the pain of cleaning like good blues. And so that's what I listen to. That helps me express those feelings about cleaning. If you think about music, we listen to different music when we're in different, when we have different states and different emotions and different feelings. Music is one way we can express feelings. Writing, singing, playing music. It may be art. It may be, affect may be laughing and crying. Those are ways we get emotions out. If you've ever been to an after luncheon, after a funeral, you hear laughter, you see tears, because that's how people express emotions. Journaling is one of the best ways we know that in times of extreme stress, people that journal do better, and they have found this with many different groups, from cancer to infertility to HIV/AIDS and sexual assault, that journaling can truly help. After disasters, journaling may be one way to get out emotion. When we think about the S in the basic pH, this is really thinking about connections. So this is time we spend with others. It may be going to sporting events. It may be playing sports. It may be going to concerts. It may be having lunch or dinner or meals or other kinds of things. You know, after disasters or mass violent events, we talk to our clergy and we say, you've got about 3 months. You're going to have more people show up at your services. Why? Because of the B, people that go to services all share those same beliefs in those congregations. But also it's a time for connection, so it fulfills the S, that's social. So time that you spend with others may be something that would be on your menu. The I in the basic pH are things that we do for imagination that allows us to relieve stress with creativity and humor. Some people like to garden. I'm terrible, so gardening would not be on my list, but people that garden say that that's a way that they can express creativity and it reduces stress. I like to bake. My friends actually like when I'm a little stressed because I bake a lot and I bring it into work. So this is where humor comes in. This is arts and crafts. This is, again, music and drawing, any kind of art. These are things in imagination. This is going to movies, which can also be very social, but it's a way to escape. So I'll share with you my secret. I am a closet romance novel reader. I am a voracious reader, and I read all kinds of things. But when I get really stressed, I pick up not a Harlequin, but I have my standards. I pick up a romance novel. Why? They're all the same novel, and any women out there that read it, you know I'm telling you the truth. They all just change their hair color, but they're basically the same. You can pick it up for 5 minutes, escape, and put it down, as opposed to like a David Baldacci or John Grisham where you have to really concentrate. Now, romance novel reading is probably not going to be on somebody else's menu of possibilities. It may be that, you know, I watch ESPN, which I do too, but there's lots of different things that we do to allow us to just escape for a little bit of time. The C in the basic PH stands for cognition, and this is things we do up in our heads to help relieve stress. These are the quintessential to-do lists. Whether you actually do them or just write them down, sometimes that helps. This is the Googling and finding information about a topic that makes you feel better for gathering. It's coming to these webcasts so that you can gain more information to cement things you already know, or to think about where do I want to learn more. These are those things we do up here. And then finally, the PH stands for physical. These are things we do to take care of our minds and our bodies. This is exercise, meditation, manicures and pedicures that take care of our bodies. Those are good. These are things like meditation and relaxation, yoga, sports, anything that, this is healthy eating and good sleep. All of those things that go into keeping our mind and body fresh. One of the things that oftentimes comes up is somebody in my group, and I can't see you, are talking and twittering among themselves, or somebody turns red and says, what about sex? So I believe it can make a difference. It allows me to express my emotions. It is wonderfully better with two. Imagination truly helps. You can check it off your to-do list. It's good for your body and it burns calories. We do not teach this to children. But again, to think about for your own menu, your own self-care, using the basic pH, how would you create your own menu of possibilities? And recognize that when we create our self-care, we know from all of the work on exercise and diet, when you do it with a partner, when you have somebody you're responsible to, you are more likely to do it. So thinking about who is your self-care buddy. Who are you going to check in with once a week and say, what did you do for yourself? And here's one thing I did for myself each week. So we reduce the risk for compassion fatigue. So with that in mind, I'm going to turn it back over to our facilitators, and you have about 12 minutes to work on your self-care plan. Thank you. Well, welcome back for our final little bit of time together. I hope all of you have developed a wonderful self-care plan and you've thought about a buddy to do that with. But in all seriousness, if you don't, you're going to run the risk of developing STS. I love this cartoon. I think you can see it. For fair selection, everybody has to take the same exam. Please climb the tree. Self-care isn't everybody does the same thing. There are so many differences. That's why it's critical for you to think about what's going to work best for you and what you can actually do. Because the bottom line is, you need to think about how do you stay calm in difficult situations, and how do you incorporate and practice self-care in the work that you do. I was recently at a Chinese restaurant and got this fortune. The smart thing is to prepare for the unexpected. How great is that for the work that we do? So the better prepared we are, the better we can do. And just in case, here are the numbers that went with that fortune cookie. So if you're so inclined, as Powerball has reached 440 million, they're the winning numbers, I'm sure, right? So with that, I think we have spent a lot of time. We could have probably spent a day on every one of these things. but I appreciate that we had the time that we did together to talk about a few things, and I think we had a few questions that came in.
Yes. So yeah, we have time for just a couple of questions in from the viewers out there. So first, could you address concerns that individuals or caretakers sometimes have when a child or adolescent is not psychologically affected by an experience, but parents think they should be?
Okay, that's a good one. So what we know is that when a disaster happens or a mass violent events happen, some of the new research tells us that you're going to have some people that really pretty much do very, very well all the way across. You'll have some that have a little bit of a spike and then it comes back again. Some that seem to be doing just great but have a delayed onset, so down the road have some problems. And then others that really have some significant problems and it doesn't go back, and we really need to make sure they're connected with good evidence-based treatments. So if you're having a child or adolescent that doesn't seem to be impacted, they may be in that group that really is quite resilient, and I would pat yourself on the back, because one of the biggest ways we know about helping kids be resilient is they have a good, trusting, caring relationship with at least one adult. So that can be there, but again, ask the question, this thing has happened, what are your friends saying? It will give you some ideas about how they're doing.
Okay, great. And another question, how would you respond to or provide appropriate support to communities that experience ongoing community violence?
Wow, ongoing community violence, that in itself could be an entire webcast of how do we address the issues of community violence. I think it's really important to recognize the adverse childhood experiences work with ACEs, that we know that children that have multiple ACEs, it's, Kelly Clarkson got it wrong. What doesn't kill you doesn't make you stronger. What doesn't kill you actually, if you keep having these adverse events, puts you at higher risk. So for those children that are living in communities with high risk, recognize that they're starting out with probably that 4 ACEs or better, which puts them at high risk for challenges as a child as well as an adult. So making sure that resources are available, that adults know what to look for so they can reach out and get services for their child or the adults in their lives, and think about what can I do given my circumstances, what's the best I can do in the situation in which I'm in.
Okay, great, thank you. All right, so that wraps up our presentation, our webcast for today. I want to thank you, Dr. Gurwitch, for providing our participants with the skills to support children and also how to maintain their own well-being during and after disasters. Again, we hope many of you out there will be able to join us for the Institute for Disaster Mental Health Conference, which is on June 7th this year, to get more perspectives on this important topic of assisting children and families. We do have sponsorship again from the New York State Division of Homeland Security and Emergency Services, which will cover registrations for most people. So please go to newpaltz.edu/IDMH, where we'll be posting details in a couple of weeks, or you can email idmh@newpaltz.edu and get on our mailing list, and we will send you that information as it is updated. A few thanks before we wrap up. First of all, many thanks to the IDMH Program and Operations Manager, Rebecca Rodriguez, for all of her behind-the-scenes work putting this event together. And many, many thanks to our friends and partners, Steve Moskowitz at New York State Office of Mental Health, which was today's event sponsor, and Tom Henry from the Office of Health Emergency Preparedness at State Department of Health. Steve and Tom worked really hard today to organize all of these details with their respective viewing sites, and I hope just in general, everyone out there really can appreciate the growing synergies in disaster mental health training and preparedness that have been going on in New York State thanks to that ongoing collaboration between the two agencies. And finally, a big thank you to our site coordinators and site facilitators out there. We literally could not have done this without you guys leading the exercises and doing everything you did to prepare for this event, so many thanks to all of you. And I hope all of the participants in the audience found this training as informative as I did, certainly. So please join me again in thanking our presenter, Dr. Robin Gurwitch, for sharing all of her insights about this very important topic, and we will see you all again next year. Thanks.